name's Claudia and I'm a registered nurse. Some of you may know me from TikTok, where I make videos about the customers I used to deal with as a pharmacy technician and my experience with them. I was a pharmacy tech for about 5 years before I left that job, and I was a pharmacy tech during my time in nursing school. And I had a lot of fellow classmates that were primary care technicians, and they swore that it was the best job to have while in nursing school before becoming a nurse. But is it really the best job? I think that being a pharmacy technician prepared me well for nursing school and my career as a nurse. So I think it would be important to compare being a primary care technician versus being a pharmacy technician during nursing school and seeing which one is better. To start, as a primary care technician, you're exposed to day-to-day hospital life. You're with the nurses for their day-to-day job activities. You're standing on your feet for 12 hours a day with them. So you're seeing how the nurses work, how they interact with doctors. So when you enter your job as a nurse after nursing school, you may feel more comfortable with the day-to-day life as a nurse. Second, you get patient care experience, which is very important. You're taking the patient's vital signs, you're washing them, you're helping them with their daily activities. And some hospitals let their patient care technicians do blood draws, which is really important to get experience in that, because as a nurse, if that's your first time ever drawing blood, could be a little nerve-wracking. So if you can get that experience as a primary care technician, then that would be great. And a last good point is, if you're already a patient care technician on a certain unit in a hospital, you might just be able to transition into being a nurse on that unit. That may alleviate some of your nerves because you already know the unit, you know your coworkers, so it would be good just to be able to transition to being a nurse on that unit. Flipping over to being a pharmacy technician, my background, first and foremost, you know the medications. A hard part for all nursing students is the class of pharmacology. And for me, that class was easier than most students because I knew the medications, what they were for, their mechanism of action, the side effects. So that class was easy for me. Next, even on orientation as a new nurse, I was more confident with my medication pass because I knew the medications and I was able to answer the patient's questions about them, why they were taking them. And even just having the confidence of knowing the medication, if the patient was referring to their medication as the brand name, I knew what they were talking about because I knew the generic name just from my job, and it just made the flow of being a new nurse easier. And lastly, being a pharmacy technician, I was able to practice with injections for vaccines. Some pharmacy techs are able to be certified in vaccine administration, so that's something that we do a lot as a nurse. Even just drawing up the medication from the vial to the syringe is good to practice because that's what we do for the most part of our day. So having that experience as a pharmacy tech definitely helped just, again, ease things in when becoming a new nurse. So each job provides different benefits when becoming a nurse. For me, I liked having the medication knowledge, knowing how to draw up medications and administer vaccines, over learning the patient care experience that I felt like I was able to learn on orientation and on the job. But everyone will prefer something different, so it depends on what type of learner you are. These are just two job options that would give you some experience under your belt before becoming a nurse. But it's really hard to say which one's the best one. Well, thanks for watching, so don't forget to like, comment, and subscribe, and look out for more videos.